Dhanvantari Namaha Shri Gurubhyo Namaha. Namaste and a very warm welcome to this wonderful session. I am Dr. Chaya and I am honored to be your host today for this enlightening webinar on Ayurveda practice, beautifully organized by Team Ayuryana. With humility and respect, I bow down to all the revered gurus and esteemed guests present here today. It's my honor to welcome our distinguished guests, the organizers, and our enthusiastic audience to today's session. I would like to introduce Ayuryana. Ayuryana is a holistic platform that brings together diverse activities, fostering a unique blend of learning, exploration, and community engagement. Its initiatives include online and offline classes and workshops, informative articles and health tips, health focused camps and events, recreational activities and excursions for students, individuals with physical challenges, seniors, and the general public. Sustainable tourism programs such as ecotourism and agritourism, Ayuryana proudly blend tradition with innovation. Events and activities incorporate traditional practices, local cuisine, and rural games. It's inspired by the timeless principles of Ayurveda, thread moral, cultural, and traditional values into every experience, creating a rich tapestry of heritage and wellness. There is an exciting announcement from Ayuryana. I request Dr. Radha ma'am to share the same.
Om Dhanvantri Namaha. Namaste all. I'm Dr. Radha Chetana, co-founder of Ayuryana. I would like to share my idea behind designing these webinar series topics for 3 months. So I considered in a classroom, out of 100 students, like 20 to 25 students will be interested in practicing Ayurvedic clinical practice. And others entered Ayurveda through chance. So, while practicing, they need the ideas how to assess the patients, such things, and the students who don't interest in the Ayurveda, they can do the Ayurvedic entrepreneurship, or many NGO supports will be there, such things. So the intention behind designing these online series, so like any of the students in the Ayurveda, as a learning phase, they can go to any of the hospitals, but should not opt duty doctor as a profession. So with this intention, designed the webinar series of both practical and these non practical subjects like Ayurvedic entrepreneurship, such things. So on 24, like apart from this, on May 24th and 25th this year, 2025, we are conducting 2 days residential workshop, that is on Ayurveda practice, where we are conducting 8 sessions for 2 days. So in that, the eminent speakers, they share their decades of experience and guide us how to apply the Samhita shlokas or the thoughts into the clinical practice. So, and even the DG field visit will be there, and many more interesting learning sessions will be conducted. So, I would like to invite you all for our workshop. So, the limited seats we take. So, register soon. So, we are waiting for you, and you can enjoy the enlightening sessions. Thank you.
Thank you, ma'am. Now I request Dr. Yashaswini, who is pursuing PG in the Department of Sastaruta in GMC Mysore, to host the session to introduce about the guest speaker. Welcome you all.
Thank you, Dr. Chaya. Our webinar series on Ayurveda practice is a free webinar series conducting on every weekend for an hour. The motto is to empower the Ayurveda fraternity to excel in clinical practice and sustainability through innovative approaches in Ayurveda entrepreneurship. Our today's speaker is Dr. Amogh A. Alekal. It's my privilege and honor to introduce the esteemed CV of my senior, Dr. Amogh A. Alekal. I'm thrilled to share his impressive credential and achievements, which serve as a testament to his dedication and expertise in the field of Ayurveda and Panchakarma. Dr. Amogh A. Alekal, Ayurveda expert and Panchakarma specialist. He completed his UG from Sri Raghavendra Ayurveda Medical College, Malladihalli, and PG in the subject Panchakarma from DGM College, Gadag. He's currently working as assistant professor in Sri Dhanvantari Ayurveda College Hospital and Research Center in Siddhapura, and he is the founder and chief consultant in Suveda Healthcare, Sorba, with Panchakarma setup. And his achievements are like published 5 articles in national journals, presented paper over 10 national and international seminars, successfully treated 150 plus patients with Panchakarma therapy in just 3 years, consult over 500 patients more at Suveda Healthcare at his young age. And his expertise in Panchakarma therapy, Ayurveda consultation, and research and publication. And noticeable recognition is he is the student of renowned Dr. Varun Sangam Healthcare Shumaga and role model for us for a successfully managing Panchakarma treatment at an OPD level with minimal charges. Let's embark on this journey together, exploring the ancient wisdom of Ayurveda and its relevance in modern times. I request audience to drop your doubts on chat box. Our sir will clarify at the end of the session. I once again welcome you, sir, and the platform is yours.
Thank you all. So in today's session, so as you are seeing on the screen, the title that is today's topic is clinical approach to different types of chikitsa. So my intention is, so as the Radha madam has told in the beginning of the session, that 20 to 25% of the students will only enter for the practice. That too, so as per my experience, only 2 to 3% will be having a strong base and they will be strong enough to practice Ayurveda, and others, so based on different approaches like their role, it may be because of their role models, or maybe because of the intention, maybe because of the necessary, so they starts to practice Ayurveda. But the demerit is, so because of lack of knowledge, maybe because of lack of exposure to clinical practice, so they will be it will be very difficult for them to practice Ayurveda, and before 1 or 2 years, so their the mainstream will become a contemporary system and Ayurveda will go to a side. So the team Ayurveda, it is, I am very happy to say that the intention of Ayurveda team is just to give importance for the clinical purpose and to make the Ayurveda student to get some trust and support to practice Shuddha Chikitsa. So in today's session, I will try my level best to just concentrate on the practical things and even the clinical types, the different types of chikitsa. So how we can use that in a clinical level. So we will start the session. So in the beginning, so what is the chikitsa? So chikitsa, according to classic and according to different perspective, chikitsa can be explained in different way. So in that, in the beginning, I want to explain you, so what Shastra says about the chikitsa. So according to the Charaka Samhita, so yabhihi क्रिया विज्जन्ते शरीरे धातवः समाः सा चिकित्सा विकाराणाम कर्म तद भिषजाम smritam. So that means chikitsa is nothing but so taking the dhatus in the samavastha to maintain the health of an individual. Even Acharya speaks, so to avoid the vikara in the sharira is nothing but chikitsa. So he also continues, katham sharire dhatunam vaishamyam na bhavet iti samanam cha anubandaha syat ityartham. So that means in the chikitsa, so we not only treating the patient, but instead of that, the dhatu samyata should be maintained. With that, the causative agents or the nidana which are responsible for a disease should be avoided. So that is nothing but chikitsa. So this is the clinical or the classical interpretation of chikitsa. But exactly, so according to the different patients, so the what exactly the patient feels about the chikitsa. So according to patient, chikitsa is nothing but just a ruk pratikriya. That means chikitsa is nothing but just a quick relief for any disease. So if he is suffering with any symptoms, a quick relief from that particular symptom is nothing but chikitsa. So he used to not focus on any system of practice usually. So 50 to 60% of the patient, they will not be knowing or they will not bother about any system. So their main intention is just to get a quick relief. So in general, so this is based on the perspective of patient. So in general, the chikitsa is so roga nidana pratikaro. That means the nidana, which are the symptoms or which are the causative agent for a particular disease. So pratikara or the against thing or the opposite thing for that particular nidana or the causative thing is nothing but chikitsa. So this is the different opinions about the chikitsa. So, and other approaches about the chikitsa is also speaks that Chaturnam Vishagadinam Shastanam Dhatuvaikrita. So that means, so Chaturnam Vishagadinam, Vishak, Dravya, Pada, Upasta, and Rogi. So these are the fourfold classification of the chikitsa, so which are included in the chikitsa, and these four will try to take the dhatu samyata and to maintain the health of an individual. And also one more definition from Bhav Prakasha. So Josha Dhatu Malanam Va Samyakrita Sa Eva Rogarit. That means so Dosha, Dhatu, and Mala should be in the Samanavastha in Sharira to maintain the health of an individual by doing the Roga Harana. So these are the different approach of Chikitsa. So as per this, the classical explanation, the Chikitsa is not only to relieve the symptoms, but also to maintain the health of an individual. So this is the main aim of Ayurveda, that is swastasya swastharakshanam and aturasya vikara prashamanam. Then, so what are the types of chikitsa? So in different types of chikitsa are there. So in that, the first thing and the foremost classification of chikitsa is nidana parivarjana. So nidana, the causative agent which are responsible for the chikitsa, that should be avoided or that should be controlled to take the body out of the disease or to maintain the health. So that chikitsa says sanshepataha, so kriya yogo nidana parivarjanam. That means the nidana parivarjana, letting the nidana or avoiding the nidana just for the maintenance of the health is nothing but chikitsa. So according to the clinical practice in different diseases, so we used to say the patient to avoid that nidana. So this is one among the free chikitsa that every doctor can give in his clinical level. So for example, so in different diseases like Agnimandyajanya Roga, it may be Grahani, it may be Atisara, it may be simple Ajirna. In that condition, usually in my clinical practice, so I used to advise the patient just to avoid simple foods, or even in some of the viharajanya or the habitual disorders in that condition, because of maybe because of his lifestyle. So in that diseases, I used to convey the patient to avoid the things that are responsible for that particular disease. So these are the things. Even in Shita Pitta, the exposure to the cold breeze is the nidana, and even some of the ahara, viruddha ahara sevana. So these things should be avoided, and the chikitsa will be that enough in the acute stage. So that is enough to control the disease in many of the diseases. In some of the diseases, in the chronic condition of the diseases like Pandu, even a nidana, which increases Pandu, may convert into the upcoming diseases, that is nidana arthakara roga like Kamala. In that condition, the patient should avoid the ahara or the vihara that causes the Kamala. So these are the different approach to nidana parivarjana. And the one-stop solution for this disease or the nidana parivarjana is that is patya palana and also the nidana parivarjana. So this is the free cost and also one among the chikitsa siddhanta in many of the diseases. So these are the theoretical things, but in clinics, the nidana parivarjana I have classified in many ways. So based on the practical experience, the one among them is aharaja or viharaja or manasika nidana. So the avoiding of the nidana or the nidana parivarjana. So aharaja. In some of the diseases, so it may be ajina. I used to say to the patient just to avoid the food which are heavy for digestion. It may be protein food, it may be lipid food, just a carbohydrate or the liquid diet. So in little quantity can be taken instead of those things which causes the disease. So in these conditions, so many diseases can be avoided just by avoiding the responsible factor for that particular disease in form of ahara. Then viharajanya. So I used to see many patients with the IT profession. They used to come for the clinic with that different diagnosis of, it may be cervical disorders, or it may be because of lumbar spine symptoms and all. So in that condition, I used to say them a simple techniques or simple nidana parivarjana method to avoid those things, to maintain the health. So this is like viharaja nidana, to avoid the viharaja nidana. And manasika nidana, in most of the diseases, so as per my experience, almost 50 to 60% of the diseases lie on this manasika nidana. So when you talk with the patient, when they feel comfort with their doctor, so almost 50 to 60% of the disease will be relieved in that condition. So particularly some patients with the directly linked with manasika disorders, like it may be stress, it may be depression, it may be anxiety. In that condition, some of the counseling with the nidana parivarjana, so he or she will get the relief from the diseases. That is the first line of nidana parivarjana classification. And the next one is just a counseling. So without any nidana parivarjana, a counseling can make anything. So I had a patient before 2 years. So she went through the angioplasty, and she used to get her BP reading 180, 190 by 100. So she visited many clinics and many hospitals, but her BP level was same. So when she visited my clinic, so just I did a counseling with her, and her problem was that her imagination about that angioplasty was something else. So it is true or false, that is secondary. Just I made her to believe that it is not a big treatment or it is not a big science. So it is a simple technique. So no need to worry and all. So these are the counseling techniques that I used, and within, you believe or not, so for the just for her purpose, just 1 week I have given her a Sarpagandhavati. So thereafter I even stopped that. So within 2 weeks, so her BP level was 130 by 80, and till now, so till now I am monitoring her BP once in 15 days, and she is having the same BP without any antihypertensive. Just a blood thinner is with her, and it was there since 5 years, and that was maintained just for the purpose of her regular visit, and nothing else was given, and now she is feeling very comfortable just with the counseling. So this is also a type of nidana parivarjana, just to make the patient to believe the thing that the doctor is saying. Then the third variety is patya. That means some of the ahara should be substituted with the ahara which are causing the nidana, or which are considered as the nidana. In some of the patient, so they used to have ajina, repeated ajina, because of the food they are taking. Instead of that, so I used to say the ahara which are not responsible for the disease. Even in the kasa, regular, the patients who are suffering with the cough, so regular cough, in that condition, I used to say them to consume, or to just consume shunti. The small piece of shunti used to chew by them. Thereafter, so almost all the kasa related to that, if it is a kafaja kasa, they used to get the better result with that. So these are the three different varieties. Then the last one is placebo effect. In many of the treatment, so even though I used to say my students also, even though if you are not confident in some techniques, so basically you just make the patient feel comfortable with you. So make them believe on you, just believe you. So thereafter, the medicine that you gives works. So I even have a patient with related to this case. So she used to say that repeatedly she is feeling so some palpitation in the chest area. So thereafter, I just took a counseling, and a Dhanvantaravati, which is not at all related in particular case, has been given to that you will feel better. And thereafter, within 1 or 2 weeks, so now she is very comfortable. So almost even after 1 and 1.5 years, she is fine. Even the Dhanvantaravati has been stopped. Even in the insomnia, that is sleeplessness or the lack of sleep, the same thing works. Just a counseling, or if you give some medicine, so as it works like a very better sleeping tablet or a sedative, and that works in that particular condition. And this is also a type of nidana parivarjana with the substitute medicine. So these are about the nidana parivarjana. So the first type of chikitsa classification. And the next thing is, so dvivida chikitsa. So there are many types of dvivida chikitsa, in that the main things has been taken for today's session. The first one is shodhana and shamana. The next one is Santarpana and Apatarpana. The third one is Rasayana and Vajikarana. And the fourth one is Dravya Bhuta and Adravya Bhuta Chikitsa. So in the Shodhana and Shamana, so what is the relevance where the Shodhana thing should be selected as your main type of treatment, where the Shamana should be taken, where Shodhana should be followed by Shamana, where the Shamana should be followed by Shodhana, and where Shodhana and Shamana should be taken in a single way. So these are the different types of application of Shodhana and Shamana. So for example, so in particular way, so in the universe, so there is a constant thing, that is, so for everything there will be a particular limit. So if it crosses, if the limit is beyond that, if it reaches beyond the particular limit, then it should be kicked off. In the same way, the bahudosha is considered as the main indication for the shodhana. Mainly the Shodhana and Shamana or any Chikitsa in Ayurveda are related with the dosha Chikitsa. So in that, if the dosha crosses its limit, if it reaches the ultimate level called Bahudosha, and directly, so you go and opt the Shodhana Chikitsa. So many diseases like Kusta, Amavata, so in these conditions, so we used to opt Shodhana as the better line of treatment for the particular disease because of the Bahudosha Avastha. Then the Shamana, if the doshas are within the limit, if the stage is not that chronic or not that prolonged, in that condition, so we used to go with the Shamana line of treatment. It may be anything, it may be Atisara, it may be Ajina, the two Vyadhi Vyap. So in the Chikitsa where the Vyadhi are having prominent than that of the dosha, so in that condition, so we used to go with the Shamana line of management. Maybe Atisara, in Atisara, so we will directly, in some condition we will go for the stambana, in some condition we will go with the grahi chikitsa. So this is the example for shamana chikitsa. Then where we will go with shamana followed by shodhana. So basically, so deepana pachana, which we used to do in clinical practice or any hospital level, before that of opting for the shodhana, so that is considered as one among the shamana. So there the agni so will be boosted in the form of shamana. So thereafter the shodhana chikitsa will be opted and the shodhana will be given. So in many conditions we used to do that. So that is the shamana followed by the shodhana. And in some of the condition where the rasayana vajikarana is required or the prolonged treatment is required, in that condition, in the beginning avastha, we used to go for the shodhana followed by the rasayana or any other shamana. So in kusta also, so we will do the same thing. So the shodhana will be given in the beginning, or in repeatedly the shodhana will be given and followed by the shamana chikitsa, like it may be rasayana, it may be shamana ushada. So those things will be carried out in some of the diseases. So a beautiful disease called Amavata, in that condition, so sometimes Shodhana alone or Shamana alone, so on a particular time doesn't work that good. So you have seen, many of you might have seen that. So in clinical level, so we used to give Gandharvastadi Eranda Taila, so 2 teaspoon HS with the Shamana line of medicines. So there, so Shamana medicine is not for the purpose of Deepana and Pachana, just for the shamana of that particular dosha and the avastha. Because Gandharvastha Taila itself is a Deepana or the Pachana Dravya. Hence, there the Nitya Virechana will be continued with that some of the medicines, like, so it may be Shaddhana Gutika, so it may be Sutashekara Rasa, it may be Simmanada Gugulu. So that will be given for the purpose of Shamananga Aushadas. So the next thing is Santarpana and Apatarpana. So Santarpana and Apatarpana are not a constant treatment for any diseases, because even Santarpana and Apatarpana are the causative agent for different diseases. So there are many Santarpana Janya Vyadis. So like Prameha, Kusta, and even the Amavata, all these are considered as Santarpana Janya Vyadi. Even there are many Apatarpana Janya Vyadi. So it may be Kshaya. So all these things. In this condition, so based on the avastha of that particular vyadi, the vyathyas or the viruddha chikitsa will be done. So that is called as santarpana and apatarpana line of treatment. So if you carry the same treatment for a prolonged time, so the treatment itself will become a nidana for the disease. So in santarpana and apatarpana, so different approach based on different condition will be followed throughout the treatment protocol. The next thing is Rasayana and Vajikarna. So as I said, during the Shodhana and Shamana, so after the Shodhana, so Rasayana and Vajikarna mainly to see it is not only a type of Chikitsa for dosha shamana or the vyadhi harana. So it is a type of swastha urjaskara chikitsa. So rasayana can be used in both way. So in many patients, so that we use rasayana for the purpose of swastha urjaskara. It may be cosmetic effect, it may be age related issue, so it may be in hair fall and all. So we, even without considering that as a disease, so we use rasayana for that particular patient. So in term of swastha urjaskara. Even in some of the diseases like kusta, so it may be amavata. Example in kusta, so we used to give madhusnui rasayana. In amavata, we will go with the amruta bhallata kavaleha. So in many pediatric cases, so kumara kalyana karasa, all these things we will give. So even swarna malati vasanta we will give in shwasa kasa. So these are the rasayanas that we will use for the purpose of vyadhi shamana. So even the vajikarna, the same thing happens here. So this Vajikarana yoga we even use for the purpose of dosha shamana or roga shamana. So or the vyadhi harana. Even it will be used for the purpose of swastha urjaskara. In erectile dysfunction, in maybe in infertility and all. So we even use Vajikarana yoga. And even for the purpose of swastha urjaskara, we use the Vajikarana type of treatment. Then the next one is Dravya Bhuta and Adravya Bhuta Chikitsa. So the quotation of Ayurveda says, Sarvadravyam Panchabhautikatvam, and almost all the things that are present in the universe so are called as Dravya. Then what is Adravya? So here the meaning of Adravya means the Dravya will be used actually not in form of medicine. So those are the things are considered as Adravya Bhuta Chikitsa. So many are there like mantra, so mani dharana. So I used to say in my clinical practice, the one, so who will be having, so the symptoms like slurred speech and all. So I used to say them to chant the Gayatri mantra. So it helps them. So without any dravya, just with the mantra, so by chanting that, their slurred speech or the speech things will be corrected. So that is one of the treatment for adravya bhuta chikitsa. Even in the chronic condition, when the patient, so that the condition will be bit difficult to treat, or so if it is a old age, in that condition, so I used to say, so I have experienced this, I used to say the Mahamrutyunjaya mantra for 21 times, and then the medicine will be applied or given to the particular patient, and even I have seen better results with that. So the Shastras has been considered very seriously about these things, and recently in Ayodhya, the same thing, the research has been undergone by doing that Mahamrutyunjaya Japa, and how it actually acts on a hospital. That means in the hospital campus, the Mahamrutyunjaya mantra has been taken as the research topic, and it has been continuously done for 21 days, and the research has been taken place, or they are considering the research. So with how it actually works on the patients. And the Dravya Bhuta Chikitsa, so that's it, the thing which I have spoken till now. So by using the direct or actual dravya for the different diseases, it may be for dosha avastha or it may be vyadhi avastha. So these are the dravya bhuta chikitsa. So it's a simple thing from the home remedies till the prescription that will be given by the doctor. All the things that works like a dravya is considered as dravya bhuta chikitsa. Then the next variety of chikitsa is so Yukti Vyapashraya, Daiva Vyapashraya, and Sattva Jaya. So in this, the Yukti Vyapashraya, so every chikitsa, so that will be considered or that will be done based on your proper protocol. So that is considered as Yukti Vyapashraya chikitsa. So in Panchakarma, so we used to plan Yoga Basti, Kala Basti, and Karma Basti. So many times, so according to me or my experience, so in many conditions, the yoga bhakti pattern will not be followed in a particular place or the particular condition. In Vata Kafaja Grudrasi, if the condition is too acute, so I will go with the Gomutra Vaitarana Basti for 2 days or 1 day based on the condition, and thereafter the protocol will be changed, and once again the yoga basti pattern will be followed. Even in that too, based on the observation of previous day or the just on the day of treatment, the observation will be done, and the Anuvasana or the Niruha Basti that will be planned, and a course of 8 bastis will be planned. And the bastis will not be like the classical way, like Anuvasana, Niruha, like that alternative way. So many times I have given one Anuvasana in the beginning, followed by 3 Niruha continuously, and once again at the end 4 Anuvasana, just to make that 8 as per the rules of Yugma and Ayugma Basti. And that protocol is considered as Yukti Vyapashraya Chikitsa in many of the condition. So beyond that classical version of uh, the things like your Anupana. So in Swarnamalati Vasantarasa, the Anupana is said is even the Madhu and Grita. So based on that application, even we use Navanita as the Anupana, and we have got beautiful results with that. So these are the Yukti Vyapashraya Chikitsa. Then the Daiva Vyapashraya Chikitsa. So as I said, the Adravya Bhuta Chikitsa, almost all the Adravya Bhuta Chikitsa, so comes under Daiva Vyapashraya Chikitsa. So in this Daiva Vyapashraya Chikitsa, so we consider, so it may be all the things which are related with the Daiva. So for the treatment of a particular patient, and most of the time, the treatment will be for the mentally disturbed or the mental health of a patient. So that is the Daiva Vyapashraya Chikitsa. Even in some condition, even for the patients who are suffering with the physical things or the deformities, we even use the Daiva Vyapashraya Chikitsa, and even it works better in many conditions. So the next one is Sattva Vajaya Chikitsa, and according to me, the Sattva is not only related with the physical health, so it can be classified into two things. One is physical health in form of immunity, and the second one is manasika or the mental health in form of willpower. So both works here. So both are very important for a particular patient. The patient may be of anything. It may be of physical deformity or a mental deformity. So both immunity and willpower are the must thing. So that used in this type of treatment. Even in during the COVID, so we used to give the Sattva Vajaya Chikitsa, so in form of willpower. So that worked better than that of any medicine. So in different patients, so I used to do that Sattva Vajaya Chikitsa. So in both willpower and in also form of immunity. So the next one is Langana, Langana Pachana, and Doshava Sechana. So as per me, so the Langana Pachana, Doshava Sechana is not only restricted for the GIT type of diseases. That means the Langana is not only a proper fasting. So Langana Pachana is not only limited for Deepana Pachana, and the Doshava Sechana. So it is not only related for the particular evacuation of the mala. It always it can be considered as the all type of diseases and even the dosha wise things. So Langana. So if anything happens for a electrical thing, so you may be observed. It may be laptop or it may be mobile. So if it doesn't work, what we will do in the beginning? So either we will just restart it, or we will switch off it. Once again, we will do the switch on just to check whether it has been corrected or not. Sometimes that is enough to make that correct. So that is like that I used to compare for Langana. So Langana treatment is just a restart or a small pause for a particular system just to get itself corrected. So it may be from the Ajirna till the chronic diseases like Amamata, a particular or the small pause is enough to get itself correct. So this is called as Langana line of management. Even it can be generalized in a patient of low back ache. So if it is only a low back ache, a small rest, it is enough to treat the patient. So that can be considered as Langana, a small gap or a reset. Then the next one is Langana and Pachana. So Langana Pachana means, so with that Langana, we even boost the Agni for the Pachana or the Deepanavastha. So even that can be generalized. In the low back ache, so the same low back ache, if it is converted in a further way, so some medicines or even some of the exercises or physiotherapy may be needed. So like charging a electrical thing, just a boost, that is enough to treat the system. Even in the form of ahara, so we can give that for the particular thing. It may be grahani or anywhere. So we can just change the ahara, style of ahara or style of vihara, and we can correct the thing or system. So that can be compared with the Langana and Pachana or the recharging. And the third particular section, when the disease or when the avastha is not treated with Langana or Langana Pachana, or these two things, when it is not enough, the doctor, when he feels it is not enough, so we can go with the dosha avasechana. Even in the, as I said earlier, so in the bahudosha avastha, directly we can go with the dosha avasechana. So like how the phone or the laptop, when it doesn't get operated with your reset or restart, so even after recharging it, when it is kept for charging, even after that, if it doesn't get switch on, then what we will do? So we will directly take it to the mechanic or the service station, and we will give for the service. So we have considered these electrical instrument very seriously, but unfortunately, so we don't know when the body require a small gap like Langana, when it is required a Langana Pachana and restart or reset or recharging thing, or even we don't know when it should be given for the service, and the Doshava should be required for the proper physiological things to go in the body. So that is considered as threefold classification, that is Trivida Chikitsa. So Langana, so you have compared with the reset, even Doshava it can be compared with the same thing, low backache. If the condition is IVDP, if there is disc herniation, if there is the disc bulge, so in the condition, so sometimes only the rest or the physiotherapy or the Shamana Aushadhi is not enough. So in that condition, we will go with the Panchakarma, different types of Panchakarma. So that can be considered with the Dosha Avasechana line of management. The next classification is, so it is about the, once again, the Trivida Chikitsa, that is Hetu Viparita, Vyadhi Viparita, and Ubhaya Viparita. The confusion in this is, so when to give Hetu Viparita Chikitsa, so when to give Vyadhi Viparita Chikitsa, and when we should go with the Ubhaya Viparita Chikitsa. So when the patient or will say the symptoms in the early stage, so when we consider that the disease is dominated by a particular dosha, so we can go with the Hetu Viparita Chikitsa. For example, in Ajirna, so we can go with the Shunti Fanta. So even a simple Shunti Fanta or even Chitrakadi Uti, so it may be Agnitundi Vati, it may be Hingvachadi Kutika, that works better just to avoid the Hetu, and the simple treatment for dosha works here. So even some of the Nidana Parivarjana method for Hetu Viparita Chikitsa, we can go just to avoid the cause and to treat the dosha. And Vyadhi Viparita Chikitsa, so the particular disease will be considered, so with respect to the avastha, so maybe example Atisara, so there directly without thinking about the Nidana, if it is in a severe way, directly we will go with the Stambhana line of management or the Grahi line of management. So that is called as Vyadhi Viparita Chikitsa. So when there will be both Hetu and Vyadhi will be stronger, that is dosha, the avastha of the dosha and even the Vyadhi are dominated in the disease. So in that condition, so Ubhaya Viparita Chikitsa, maybe Dashamula Kashaya, so in Vataja Kasa, Vataja Shota. So Dashamula is both Shotahara, even Dashamula is also in the form of dosha, Vatahara, even the Shotahara. In that condition, we can go with the Ubhaya Viparita Chikitsa. So in the next thing, so it is Chaturvida Chikitsa. So there, Samshodhana, Samshamana, Ahara, so in form of Patya Palana, and the Vihara, so in form of following the, so Dinacharya, Rutucharya, or the proper lifestyle. So these are the four types of Chikitsa. So Samshodhana and Samshamana, so already we have discussed, and Ahara and Vihara. In some of the diseases, just a change in Ahara is enough to restart the body or the system. So in that way, the Patyapalana is most important. In Amavata, in many of the conditions, so Amavata, so as it is according to the contemporary science, so it is an autoimmune disease. So throughout the life, it is very difficult to give the medicine, and even the patient feels that as heavy. So in that condition, a simple change in ahara in form of patya will help like anything to treat that diseases. Even the vihara, so in the particular vyadhi also we can go with the vihara, some changes in the vihara, but in some of the diseases, so which are called as the professional hazards, So it may be varicose vein, or even it may be a simple IVDP. In that condition, so if the condition is simple, so we can just say the patient to change his lifestyle and the result can be given. So this Vihara is not only restricted for the lifestyle, even the manasika things like stress management. So it may be anxiety issues that can be treated. So with the management of Vihara. So the one should be advised to be busy and to avoid the stress and anxiety, and he or she may give or get some relaxation through that. So this is called as Viharaja line of treatment. Then the next one is, so once again, the Chaturvida Chikitsa, that is Brihmitavya, Prashamitavya, and Nirharitavya, and Paripalya. So mainly this Brihmitavya, the word Brahmana here says about the Dosha Brahmana, where there will be Dosha Kshaya, so maybe Rajayakshma, maybe Kshatakshina. So in that condition, it may be the delayed milestone. So in that condition also, so we will go with the Brahmitavya, that is Brahmana line of management. So even the simple Grita Bhojana, so during the Ahara Sevana, can give much better in this type of condition. So it is considered only for the purpose of Dosha Brahmana. So Prashamitavya, so it is also for the purpose of Dosha Prashamana. So many diseases like Santarpanajanya Vyadi, there the Prashamana is required. So in that condition, we will go with the Prashamana line of management just to treat the disease for a particular time. So that is called as Prashamitavya. And Nirharitavya, as I said already about the Dosha Avaseshana, the same line of management will be done for this Nirharitavya. So when the Brahmitavya and Prashamitavya so are not enough, or the Vyadi has gone up to the Bahudosha Avastha, there we will go with the Dosha Nirharana or the Doshavasechana line of management. So that is called as Nirharitavya. And Paripalya, so that is Swastasya Swasthya Rakshanam. To maintain the Swastha, the Paripalana of the Samadosha Avastha, the equilibrium or the homeostasis condition of body. So that is nothing but the Paripalya. So maybe Nitya Rasayana like Shira, Madhu, Gruta, that will be used for that purpose. Even through the Dinacharya like Abhyanga, so Nitya Snana, so Dantadamana, it can be maintained for the purpose of Paripalya. So these are the different techniques to use the Paripalya line of management. The next one is, so the Panchavida Chikitsa. So these are nothing but the mainstream things that we follow in the Panchakarma Chikitsa. So like Vamana, Virechana, Nasya, Basti, and Rakta Mokshana. So as you already know, the different indications of Panchakarma. So like Vamana, so particular dosha where it will be involved. So in that condition, we will go with the different types of Shodhana and even the Panchashodhana or Panchakarma. So even in different things, the practically how we opt the treatment. So that is considered as the Panchavida Chikitsa. A small example, in some of the condition like PCOD and all, so usually we will plan for the Virechana sometimes, and based on the Utklishta dosha on the day of Samyak Snigdha Lakshana, so directly we will plan for the Vamana. The protocol will be entirely changed and we will go with the Vamana line of treatment. So that also we have done, and based on that, so different applications can be used for different treatment. Even the Rakta Mokshana, one among the treatment protocol, when the dosha, so the disease is more than that of that, if it is Dhatu Ashraya, so like Rakta Dhatu Ashraya, so in that condition, so directly we will opt the Rakta Mokshana in different way to treat the diseases. So this is considered as Panchavida Chikitsa. Then the next one is, so the Shadvida Upakrama. So all these are the classification. So the Panchakarma is derived from this Shadvida Upakrama. So even though, so already I have mentioned about the Santarpana and Apatarpana line of management. So the different types of Santarpana, where the Brahmana should be used, where the Snehana should be used, and where the Stambhana should be used. That is most important. When the particular Sharira or the Roga is depend upon the Vata, and when the Brahmana is required or when the Santarpana is required, so there we may go with the Brahmana types of Ahara or Brahmana types of Aushada. When the Brahmana is required in form of Rasayana or the Vajikarna, so or in form of Basti, so we can go with the Snehana. So So in Abhyanga and also, so we will go in Brahmana line of management. Through the Abhyanga also, we can do the Snehana and give the Brahmana effect. Even Stambhana, so that is considered as a type of Santarpana Chikitsa, and in many diseases like Grahani. So Grahani, basically it is not only a physical disease. So in the later form, even the Manasika Avastha will be added to particular disease, and because of that, so there the Apatarpana things starts in the Sharira when you observe the symptoms. So in that condition, so the Stambhana and other treatment to do the Brahmana will be carried, and this is the different approach to do the Santarpana. Even Apatarpana, so in the same way, so as I explained earlier, so Langana, Rukshana, and Svedana are the different approaches. So that will be carried for the purpose of Apatarpana. So here, the based on the bala of a particular patient, the treatment like Langana, Rukshana, and Sedana can be given. If the bala of the patient is not that strong, so then you can directly go with the Langana management. Even the avastha of the disease, if the avastha of the particular disease is in very acute stage or in the prathama avastha or in the beginning stage, you can go with the Langana line of management. So thereafter, even Rukshana and Svedana, maybe because of the purpose of Shodhana, maybe because of the upcoming Santarpana Chikitsa also, we will go with the Rukshana and Svedana line of management. So all three are considered as Apatarpana line of treatment. Even the Shodhana, so the shloka says Chatushprakaro Samshuddhi, based on that, so that is also considered as one among the Langana, and that comes under the Apatarpana line of management. Even the Dosha Shamana, so there how we said that Prashammitavya, so that also comes under the Apatarpana, as the dosha will be subsided in particular condition. The next treatment, so that is, so the same thing. So Aushadha, Anna, and Vihara, or the Ahara, Vihara, and Aushadha. So this will be classified based on the Hetu, that is Nidana, Vyadhi, that is Avastha of the particular disease. So that has been classified into 18 varieties to conclude as a Chikitsa. So in that condition, the Hetu Viparita Chikitsa. So earlier only we discussed in the threefold classification. So here the three things, the Aushadha, Ahara, and Vihara are considered for the purpose of treatment, and it will be given for the patient to treat the different diseases. And the examples are here. So like in the condition, so like Kafaja Jwara, if the example has been given in Kafaja Jwara, so just with the Aushadha, if you want to treat that, a simple Ushnodakapana or Ushna Dravya Siddha Aushadha will be given to treat that particular disease, and it acts on the Kafaja Jwara in form of Aushadha, and that can be treated. So if the same thing, if it is okay with just to treat the disease with the change in Ahara, then you can go with the Kritayusha. So even the Kapha Vilayana will take place, and the Vyadhi, which is because of that particular disease, the particular dosha like Kapha, so that will be subsided. For example, it may be Krishara or it may be Kritayusha, so that can be given. So I used to say that Maricha and Shunti should be mixed in a particular proportion, and that Kashaya will be given in Kafaja Jwara. And because of that Kapha Vilayana, so the Jwara will be relieved within 2 or 3 days. Then the Viharaja, in some of the condition, so even in Kafaja Jwara, so particular some exercises or the rest, so based on the condition, so that can be induced just to treat the diseases. So even in some of the diseases like disc related issues, or it may be osteoarthritis, in that condition, if the patient takes proper rest, the rest is enough to better the condition of that particular issue. So this is considered as Viharaja Hetu Parivarjana, or the Hetu Viparita Chikitsa. Then the next one is Vyadhi Viparita Chikitsa. In this condition, so the Aushadha, so like in Sandhivata, the example is Sandhivata. In that condition, so the Mahanarayana Taila, if it is given for the purpose of Abhyanga, so that is enough to treat the disease. So this is called as Aushadha. The Mahanarayana Taila is the Aushadha here, and it is for the purpose of Vyadhi, not with the Hetu. Hetus are not treated here. So, but the Vyadhi, already the stage has been crossed to the Vyadhi, and in that condition, the Mahanarayana Taila will be used for the purpose of Abhyanga. The next one is anna. So once again, the ahara. So use of the grita. So in osteoarthritis, so the grita will be advised. The grita which is already or we are using in the home, the same thing can be used form of ahara in their particular bhojana, and that is enough for a long term. If they use the same thing, so that will relieve the pains in sandivata. Then the next one is vihara. If the patient used to follow the rest, proper rest, and minimum exercises, and that is enough to treat the sandivata or the sandigata vata. So this is considered as the viharaja vyadi viparita chikitsa. The next one is hetu and vyadhi viparita chikitsa. Here both hetu and vyadhi are considered for the treatment. So in that condition, if it is with the aushadha, so the same dashamula kashaya will be used in vata jagulma. So here the dashamula kashaya even works on the vata, so which is because of the hetu. So vataja ahara sevana, vata khara ahara sevana are responsible factor, and this dashamula acts on vata, and even it acts on the vyadhi called shota. So both the vata and the shota will be managed with the same medicine, that is dashamula kashaya. Hence, so this is considered as aushadartha hetu vyadhi viparita chikitsa. Then with the ahara, that is with the anna, so if you use the peya, so that is in vataja shota, so that peya, so which we use of peya in cold induced, if the vataja shota is because of the shita sparsha or shitaja nidana, so in that condition the peya ushna peya will works as the best vatahara and even shotahara ahara in that particular disease. Then when it is considered for the vihara, a proper rest in vataja shota, so that it helps for the purpose of relieving the pain or the symptoms. And viharaja hetu vyadi viparita is so the rest for the purpose of vataja shota. Then the next one is hetu and hetu viparita. Here the viparita is the causative agent that causes the disease will be used to treat the particular diseases. So in some of the condition we use agni karma to treat that particular disease. In the same way, so basically agni karma is rukshana, so that is used in calcaneus spur. So that is the hetu viparitarthakari chikitsa in some of the condition. In many conditions we use dashamula kashaya. So basically dashamula kashaya is ruksha, still we use that for the purpose of myalgia, in treating the myalgia. The parisheka of dashamula kashaya helps in myalgia, so that is also can be considered as aushada in hetu vyadhi viparitarthakari chikitsa. Then the aushada, here the hot fermentation, the same thing has been explained, and hot application of the different medications or the aushada in form of pittaja vrana. So that will be used for the shamana of the pittaja vrana. Then with the anna or the ahara, so that is like ushna and katu ahara, rasayukta ahara will be used to treat the kamala. The agni deepana will be done, and the same thing helps to relieve the symptoms of kamala. Then viharaja. So in this condition, so the example is vataja unmada. If the patient is made to get the fear, so in that condition it helps to relieve sometimes the vataja unmada. So this is the viharaja hetu viparitarthakari. The hetu here, same thing, the fear which is responsible sometimes for the purpose of unmada will be used to make the patient subside the particular symptom. So that is called as viharaja hetu viparitarthakari thing. The next one is related with the vyadhi viparitarthakari. So in this condition, the usage of the madana phala in nausea, the condition called nausea. So sometimes the fragrance of that madana phala subsides that nausea effect. So this is the aushada, the use of aushada for the vyadhi viparitarthakari. The same madana phala that we use for the purpose of vamana in treatment, and here, so that is used to control the rullasa. Then the anna, so use of kshira in the form of, so the ushna kshira will be given in condition called atisara. The same kshira sometimes acts as nidana in the atisara, but in vataja atisara, ushna helps for the purpose of stambana, and in that condition it can be used as the ahara in vyadhi viparitarthakari condition. Then the vihara, In Rillasa, sometimes the straining which causes the vomiting will be used to make the patient to control or to subside that Rillasa. So this is Viharaja Vyadhi Viparitartakari follow. Then in Hetu Vyadhi Viparitartakali condition, so the same three classification like Aushada, the use of animal poison, that is the Jangama Visha will be used to treat the vegetable Visha. So in that Stavara Visha, in that condition, the Jangama Visha will be used to treat that particular disease. This is both Hetu and Vyadhi Viparitartakari thing. The same Visha will be used to subside the Visha related with the Stavara Visha. Then the Anna. So the use of Madhya. So the dravyas like Kharjura, it may be Draksha. So these things will be used. So which are having the qualities of Asavarishta, which are used for the purpose of preparation of different fermented medicine. So that will be used to treat the avastha called Madatyaya in form of Anna. So the same thing in Vihara, the swimming. So that is the responsible factor for the Urustamba in different way. So that can be used to relieve the stiffness that caused by the Urustamba in Viharaja. So in the minimum swimming, so that helps to relieve the stiffness so that presents in Urustamba, and this is considered as the Viharaja type of Hetu Vyadhi Viparitartakari treatment or the Chikitsa. The next we will deal with some of the clinical cases where I have used the different types of uh, classification of Chikitsa. So this is a case of hypertension. So in this condition, so when the patient visited my clinic, so his BP was 240 by 100. So just I took a history of him. So I felt, so it was because of the anxiety, and he was a chronic smoker, and that may be also a cause for that hypertension. So already he was taking a antihypertensive drug, but still since 6 months, so it can't be controlled. So even after taking a drug, so antihypertensive, his BP was 240 by 100, and there was no any changes. So basically my intention is some of the diseases like hypertension or the diabetic, whether it can be considered for the treatment or whether it should be referred. So that is the thing that we all should understand. So if the condition, so like this, so if the BP is more than that of the 160 or 180 in a particular age, so if the patient is already taking antihypertensive drug, if the contemporary system fails to treat that disease, so it is your chance to take a chance to treat that particular disease. So with your Yukti Vyapashraya Chikitsa. So in that condition, so already I have mentioned, so that history of taking telmakind. So telmisartan with the amlodipine and hydrochlorothiazide. So it was given, and still his BP was 240 by 100. And later I just included Arjuna Arishta and Sarpagandhavati, and just I advised him to strictly avoid that smoking. And within a period of 10 days, so from 10th of December to 20th December, so his BP just comes down to 190 by 100. Even later the same medicine was given, and in the following things or the follow-ups, upcoming follow-ups, so his BP, so even it reached to 160 or 170 to 90. So till now the same BP has been maintained. Even the drug, so that has been reduced, the contemporary medicine, so the telmikind AMH is converted to just a Telma 40. The 1 BD he is taking with the same dose, but just with the telmisartan, the other Ayurvedic drugs are going, and he is very healthy. And even recently, the ECG has been taken, and he is fine with the thing. But the main thing here is maybe even the Nidana Parivarjana with the medicine has worked. So it comes under both the Nidana Parivarjana and even the Yukti Vyapashraya Chikitsa. So this is the case. So just last month, so I'm got a case. So with the complaint of variation or the harshness of the voice, and when I did the examination thoroughly, so I just found that so he was a chronic smoker, and even since 6 months, so he's not doing that. He was not having any habits in 6 months. Still, the symptoms was presenting like So like there may be a metastasis. So when I poke him, just I got this biopsy report that has been taken just 3 months before when he visited my clinic, and in that the report was negative. So the biopsy report was completely negative, but based on the clinical condition, I felt that it should be sent for the CT once again, and later in just within a period of 3 months, so it has been, so he has been sent for the CT neck and the observation. So you can observe, so there is likely metastasis. So the level 2 lymph nodes enlargement was there, and there is the metastasis has been the diagnosis. So it is very important to diagnose the disease, even though if you can't label or name the disease, just the condition should be understood. And these are the simple mistakes that we can do in the clinical practice. So with that belief that we can do everything, sometimes we can't. We should understand the disease, and we should make the patient to understand the condition, and we should refer without any hesitation. So he was referred for CT scan, and just the observation that I got, and thereafter, so we need sometimes the support of other system. So it was referred just to take an opinion. So later, so we should see whether to treat, whether the excision should be done, and all these things are the treatment that we can plan in the later days. So the next thing, so this is exactly the Dravyabhuta Chikitsa. So the plantopalmar psoriasis. So these, so I have said you already, when I used to do that Shodhana and Shamana, sometimes it is necessary to go with both Shodhana and Shamana together. So in this condition, so these are must treat diseases in Ayurveda. So we should never neglect, or we should never leave such condition. So this should be treated. The patient should be convinced to wait for particular time just to make the disease to come under your control, and it should be treated. So in this condition, just a Nitya Virechaka and the Shamanausadas has been given, and based on the season, sometimes even I stop that, and based on just a Nidana Parivarjana, so for 6 to 8 months it will be maintained. Once again, in the summer, the treatment will be given, that is Nitya Virechana will be given with Shamanaushada, and in the rainy season and the winter, so he feels much better. It is because of the Pitta dosha, and that particular period, like end of February to June, the treatment is must. And later with the Nidana Parivarjana and even some of the Nitya Rasayana like Grata and Kshira, that can be treated. So you can observe the changes before and after changes after the treatment, and it is just within the 1.5 month period. So the next thing is Kitibakusta. So even in this case, so in this case, just a Virechana, that is the different thing that has we have done. So without any much Shamanaushada, with the Shodhana, so the observation changes that you are observing is just because of a simple Shodhana. So there the Aragvada Mahatiktaka Grita is used for the purpose of Snehapana, and Virechana is done with the Trivrut Leha, and this is the case of Kitiba Kusta. And these are the must treat diseases in Ayurveda, and you will be having time to treat diseases. When the patient comes to your clinic with such symptoms, so he'll be already taken much medicines, and many opinions would have been already taken, and so it is your time to treat that particular disease with your yukti. The next thing, some of the challenging diseases in Ayurveda. So it may be like hypothyroidism, so it may be rheumatoid arthritis, it may be gouty arthritis. So this is the case of hypothyroidism. So the patient was suffering with the hypothyroidism since 3 years, and when she visited my clinic, so she was already taking thyroid norm of 50 mcg, and her TSH level was 13.5. So later, the medicines was given just without any Shodhana, without any Panchakarma, that's just Shaman Aushadhi. And the treatment I did was, so just the Deepanapachana. So just a simple Chitrakadivati and Sutashikara Rasa was given to treat the disease with the particular symptom. So the results, change in result that you can observe from 13 to the TSH level was decreased to 5.53. So the period was very less, and within that we observed this, and even later in the later stages, so her dose was reduced, that contemporary medicine dose from 50 mcg to it has been reduced to 25 mcg, and now she is taking the same tablet once in 2 days, and the medicines was maintained, and even now the level is same and without any complaint. That is the main thing, that she is not having any symptoms related to hypothyroidism. So this is a case of diabetic mellitus 2. So I have lost the reports. So why I have chosen this case means the patient before almost 2.5 years, so he visited my clinic with the HbA1c of 8.9. So when I went through that particular case, so even the lipid profile and the LFT changes I observed, and just I understood. So as per the Nidana, so this is the beautiful case for the Santarpana Janya Vyadhi, and I did not do anything. Just I said him to change some lifestyle and the food habit, and just a simple medication was given, and within 3 months the HbA1c became normal, that to 5.5, and till now, so he is just under the follow-up without any medication. Still now that HbA1c is same 5.6, it has been maintained. And why the case was selected means sometimes, so it is not the diabetic reversal thing. Here, the diabetes is because of the malfunctioning of the liver. So that should be treated. Even I observed some of the symptoms of jaundice, the viral jaundice, hepatitis. So it was completely treated. And so when you observe the investigation report, sometimes that is maybe because of a particular symptom or the lifestyle of particular day. So even in some of the condition, the HB level will be very low. So when you poke the case, you will understand that there will be a regular cycle will be going on. So the monthly cycle or the menstrual cycle will be there. So these things should be understood. These things should be ruled out before considering that into the diagnostic aid. The next thing is a case of rheumatoid arthritis. So in that you can observe, so even though the patient was having very least symptoms, so his RA factor was 104, and even so he has undergone 2 times the panchakarma treatment, but it was in the some other clinic, but the level was not that reduced. Even some of the symptoms that he was saying when he visited my clinic was the same. So later, just he was considered for the treatment. So because of his patience and the treatment, just within 4 or 6 months, the changes like the RA factor went to negative, that is 10.8. And this case was selected because when the patient comes to your clinic, sometimes the assurance can't be given. So you should make the patient to believe that so some of the diseases may not have a particular or the lifetime pause. So he need to live with that particular disease, but we can better the symptoms so that we can give him or we can make him to live better without any symptoms. But but the investigation things will remain positive. That is the thing that you should convey. But luckily, and sometimes if the patient and the system of his particular body responds to your treatment, so it may even go into the negatives. That is the thing which has happened here. So the next case, so that is the particular gouty arthritis. So in this condition, even in this condition, so just 15-day medicine with the Nidana Parivarjana treatment, sometimes the Viruddhahara. So that is the responsible factor for the rise in the particular value in the disease. So here the uric acid, the main food of that particular patient was, so she used to consume dry fish with milk every day in the night meal. So that was the thing which was asked to her, and with by taking the clear history, just I advised her to not take such kind of food and just a simple medicine. So like Kaishwara Gugulu and even that Vasa Guduchadi Kashaya was given, and within 4 or 5 months of period, the uric acid level from 43.7, so it has been reduced to 6.51. So this case says you the importance of Nidana Parivarjana. If the same thing she consumes for a long period, the condition may become worsen, and even it may reach the condition of incurability. So what we should do? So we should simply ask the patient to reveal everything related to Nidana. thereafter only the diagnosis should be done and the treatment should be started. So the next thing, so these are the cases that we discussed was from my clinic. And then some of the thing, even though it is not directly relevant, some of the home remedies, so that can be given or advised for the patient to relieve the many symptoms in the beginning stage of any disease. So the common cold, in some common cold, so as I studied from my sir, Varun sir, he used to say a simple steam. So like the betel leaf, by using the betel leaf, it may be a pepper and the shunti and some sort of salt, that is saindavalona, and even the haridra churna will be added with the 1 liter of water, and it should be boiled. At the end of boiling, some tulsi leaves should be used. So thereafter, so it should be taken for the purpose of steam. The simple common colds can be relieved with that, and with that some applications has been changed based on the dosha have changed. Sometimes even I will give like chausta pipali churna for that particular thing, even a medicine, that Unani medicine called ark ajib, so that is the extraction arka of that ajwana, so that will be used for the purpose of the steam. That can be also used in different way to treat the common cold. And in renal calculi, so I used to say for the patient, so that the banana or the kadali kanda swarasa, so that can't be given through the extracted, it should not be through any mixie or not. So that should be cut, and then the slices should be given to chew or squeeze that. Thereafter the swarasa should be taken, and with that, so in many condition, if the renal calculi is less than that of 5 or 6 mm, so then in that condition, if it is a non-obstructive one, so you can go with this home remedy. And in some of the clots, if you observe some of the external clots, so because of the accident or because of the fall and all, so in that condition, just the durva swarasa, which is the best anticoagulant. So even that durva we use in cases of raktabasti, the same thing can be given. The durva kalka or the swarasa should be taken, and it should be applied over that particular part, and you can observe the changes within 3 or 5 days. The next one is hiccups. So in this condition, a kulatta kashaya, the kulatta kashaya can be given so continuously. So like your mohur type of chikitsa or the aushadha sevana kala, that can be given in hiccups, and you can observe some of the changes by that. Then in anemia, so in many cases, so I used to, if the agni is better, so I used to say them, so in the night, just before going to bed, just to soak some like 10 to 15 groundnuts with the 10 to 15 grapes, the dry grapes, and it should be mixed in the early morning or the morning, and it can be even mixed with the milk, and that can be given in the condition of anemia. A simple home remedy. So even it will be used in form of different types of beverage. The same things can be mixed with the milk, and that can be given with guda and all. So it is very best treatment or the home remedy. So if the patient is not willing to take medicine, or if the anemia is in kids, in that condition we can use this type of home remedy. And in lack of memory, if the memory is less or the lack of memory in that condition, so simple madhudaka, so that can be used in the early morning. The madhudaka should be prepared, which is a classical thing that has been explained in classics. So even in Ashtanga it has been explained. So that madhudaka can be given regularly. So in the case of lack of memory. So in some time, the direct symptom. So when the patient says like lack of memory and all, even the before the diagnosis, so you should rule some of the conditions, like, so that it should be ruled out, like vitamin B12 deficiency, vitamin D3 deficiency, vitamin E deficiency, that should be ruled out before diagnosis or before saying any medicine or home remedies. If that is not the case, if it is just because of age or anything else, so then you can go with the home remedy or even medicine. Otherwise you should treat the cause, so thereafter you can say the other things. And in dry cough, so in dry cough, as I already said, so based on the condition, you can go with the shunti. So or the ardraka swarasa can be given in the early morning with the madhu. So that helps for the relief of dry cough. And in pre-diabetic, so based on the discussion with my one of the senior when I was doing the MD, a small changes has been done in that case, and a medicine or the home remedy has been that means advised for the patient, and even it has given a good result. So like that, by using the methika and krishna jiraka, haridra, and also twak in a particular proportion. So in that proportion, if it is mixed well properly, and 1 teaspoon or the 5 gram BD or OD based on the condition and the age, so that can be given in pre-diabetic condition, and it works beautifully in that particular case. And sinusitis. In the sinusitis, so like even not only with the abhyantara prayoga, the bahya prayoga, like it may be ardraka and nimbuka. The ardraka kalka or the paste of ardraka with the nimbu swarasa that can be applied throughout the forehead, and that helps for relieving the kafaja shirashula. It can be considered as sinusitis and it can be treated. And in stomatitis, so this is the medicine that I have learned from my grandmother. So like that, guava, the pallava or the tender leaf of guava should be taken, and it should be squeezed or chew. The chewing should be done with that, or squeeze it in the mouth. So because of that, so in the early stage of stomatitis, so it can be, so you can get a better result with this type of simple home remedy. In slurred speech, in some of the condition, even we can use adravya bhuta chikitsa. So like rudra, or even the Gayatri mantra patana, the chanting of Gayatri mantra or even the rudra, that can be followed just for the purpose of slurred speech, and you even gets better result. So with that, so these are the different home remedies, and you can even add or identify the home remedies. Just you can do the trial and error, and by that, so you can achieve a good result with that. So the next thing is, so at last, so some of the challenges. So during the Ayurvedic practice, even I have faced this, and even by the discussion with the other students or the friends, so I have collected something. So the lack of basic knowledge, quality education, and the practical exposure. So what we should do with that? So if the person is suffering with these things, so already even so I have experienced sometimes. So maybe because of the area, sometimes some particular area will only give or the exposure to particular cases. So in other area, so the diseases, when you start the practicing, so some different diseases which you have never seen practically, so that may come. So in that condition, the how to improve your knowledge, for that the my best thing or the best advice is just discuss the thing with your lecturers, or just discuss with your seniors, and even write that particular case in a book, and in the evening just refer the samhita and just search for that, and combine your own medicines, and just learn with your seniors and practice. So that works very beautifully. And reading samhita, so if not every day, so even at least when you get a challenging case, just go and search in your samhita. Of course you will get the solution. So our samhitas are like bhagavad gitas in shvitra. So I have seen, so when the cases of shvitra comes, every time the things will be very unique. So in charaka chikitsa it has been given very beautifully, even based on the chikitsa sutra or the explanation that has been given. So you can give some better result in that case. So just for that particular question, you go through the samhitas and discuss the things, and you can do the better thing. So the inferior complex and comparison. So never compare things with any other science or the contemporary science or any of your friends, because so you may be knowing. So when we started our BAMS, so without going to third or final years, so our own friends who completed the other things, so it may be any other courses, they started to earn. So we never compared with them, because our course is entirely different. The satisfaction that we are having in our course, the thing that we are facing and feeling, the happiness that we are getting in our course, even the respect that we are getting with the other system is much more than that of the other system or the other things. So you never compare. So Ayurveda, so in the next question also I have compiled that. So there I will explain you. So never compare or never think that you are inferior. The every day, it may be one case or three case, you do your best to treat your patient. And most probably the commitment, your interest, and your involvement in the particular system of treatment always gives you much result. So don't worry about any other thing. Just you try your best to practice Ayurveda. Then the next one is extreme intervention of the patent medicine. In Ayurveda, this is the challenge. So intervention of the patent, how that will do means, so the based on the dose, our system is just to treat the case based on the samprapti vigatana or the dosha. So in some medicines, so I don't use to say you the name of the medicine, but in some medicine, even vatahara, pittahara, kapahara, it includes Estimaduchuna, it will be included Panchatikta Kashaya, even it will be included Simmanada Gugulu. Where it should be given? So that is the exact thing that you used to suffer. And the second thing, when you practice in with the your guide or any other doctors, so there will be some patent medicine and you changes your place or your way of approach. It will be very difficult for you to follow the same thing. At that time, what to do? So the classical medicines, so those are the forever solution for every treatment. So be strong with that particular medicine. So even a single medicine beyond the indication, so that can be given in many diseases. So make use of the classical medicine and start your practice. If you get any confusion in the diagnosis, then only it is better to go with the patent medicine. Then the lack of commitment, I have already said, it is most important. The timing of your clinic, so maybe the commitment or the intention to treat the diseases, and you should never go with the hurry approach by comparing the other system of treatment. So then only you will get some success in your stream of treatment. Then where to keep, how to convince, where to refer, and whom to refer. So this is the important thing that you always face. So already I have given an example of hypertension, even in diabetic. So the my approach is I will try my level best to treat the diabetic condition. So based on the dosha avastha, if even after 3 to 6 months, if it crosses or goes beyond its particular range, of course it is better to refer than that of taking risk. If the patient is well versed or believing you better, so of course he will be in touch with you even after taking the contemporary medicine. And later, once after getting the control of that particular disease, once again you can reduce the dose and you can intervene your medicine and make him feel better. So you should be very careful while taking the case, while referring the case, and even you should be knowing whom to refer. And it is better to be in contact with the patient even after referring. If the patient is supportive, you should be with contact. Then you will understand, you will learn more things, and you can refer him very better in upcoming cases. Then the next one is the lack of experience and exposure. So in emergency handling, of course, so this is the main drawback, and this is the practical thing. So for that, so you should correct yourself, and either you should go with the particular doctor or the guru that he makes you learn many cases. So or at least you be in contact with him, and every day you should learn something to make it better. So the experience or the exposure of clinical cases or the emergency condition, even the cases like acute backache, so it may be IVDP, even acute rheumatoid arthritis, Ayurveda works better. So you should be knowing where it should be taken for the treatment, which type of treatment should be given. So that is up to you. Then the intervention of contemporary medicine. So this is a question. So according to me, so as I saw, so it is up to you. So whether you will add your own medicines, so with the contemporary medicine or not, or we will take the support of your colleague who practices the other system. So that is left to you. But according to me, so it is not that bad sin or the sin to give some of the contemporary medicine when it is too emergency. But it is left to you. I don't used to practice that, but you can practice. But in future, it should never come to you as a mainstream of medicine. With your own Shuddha Chikitsa will be sidelined. So it should never be like that. in very emergency condition, so you can use, that is left to you. But the thing is, you should be at least knowing the proper thing or the theoretical knowledge about that particular medicine that you are using, which is not of your system. So then only you can use. Then a myth like costly and slow result. So according to me, so the Ayurveda medicine can also be given in a very economical way. So in my clinic, so usually, so my total cost of medicine, so that Shamanaushadhi when I give, so it may not cross more than 300 rupees for 15 days. So that is left to you. Based on some condition, even it may reach 400 or 500, that is secondary. But in most of the time, when you use classical medicine, so it may not reach more than 300. Even that should be in your mind when you will be sitting in a local area. So practice with other doctors, it is the most important thing to even think about the economical state of the patient. When it is necessary, it is secondary. When the patient believes you and it is must treatment, or Ayurveda is the only thing that can treat that particular disease, of course, you can go with the costly medicine. But in other system or the other way, of course, it is better to go with the economical medicines. Then the slow result, of course, it is not. So you should never compare the disease or the practice with others, because here the cases will be entirely different. As the Ayurveda speaks, Pratipurusha Siddhanta, every case will be different, every individual will be different. So always I used to give the patient example of arecanut. So arecanut is a better crop to earn better, but it takes almost 5 to 6 years. So in our local area, that is the main crop. So I used to give the example, when the person or when the farmer starts to farming that paddy or other thing, so it may yield within 6 or 7 months, but the income will be much less when you compare with the areca. So it takes almost 5 to 6 years. In the same way, so Ayurveda medicine also, there already I have explained you, it is not only the quick relief, it is dhatu samyata. So to achieve dhatu samyata, it takes some time. So it is not it is exactly a myth that Ayurveda is costly and it gives slow result. And at last, the important thing, so exactly after discussing all the things of Chikitsa, the final question is, what exactly a right treatment? So even Charaka explained that. So the right Chikitsa or the Shuddha Chikitsa, which is Prayogaha Shamayed Vyadim Yo Anyam Anyam Udirayet Nasi Vishuddhaha Shuddhastu Shamayedau Na Kopayet. That means the treatment while giving or the medicine which has been given, so it not only relieves the symptom of that particular disease, but even it should not vitiate the other symptoms or the other disease. That system of medicine or that type of treatment is called as Shuddha Chikitsa. So I hope all the listeners or the practitioners of Ayurveda will follow this type of Shuddha Chikitsa and you will be succeed with this. Thank you.
Yashaswini, you are not audible.
Uh, Thank you, sir. Now the session is open for the question and answer. There are a few questions in the chat box. Is it visible for you, sir? In comment
Yeah,
section,
yeah. So the
please
first
go through that,
question,
sir.
yeah, how to treat acute disease? So as I already said, so it is based on the avastha of the disease. So I can give you some example. In certain condition, even the Chikitsa Sutra, some of the Chikitsa Sutra, like Ridrasi Chikitsa Sutra, Antara, Kandara, Gulfa, Sira, Bastyagni, Karmacha. So particularly in this disease, the Chikitsa Sutra explains that the Agni Karma is the better way to treat Gridrasi. And that Agni Karma is in acute condition only. So based on the different condition, so maybe because or with the Shamanaushadhi only, we may not treat certain diseases. Even we can treat the diseases with Panchakarma. Simple Churna Bastis in many diseases, in renal stone, some colic pain in that condition, even a Churna Basti, which works as the beautiful Anulomana, even works to treat that particular symptom. And later, so we can take some time to treat the diseases. And even in IVDP, in that condition, even you can go with the Tikshna Bastis or the Kshara Bastis. So maybe you have observed or not, I don't know. So some of the Bastis like Vaikatarana Basti and that, they don't have any restriction, even the Madhutailika Basti. In that condition, any sort of Purva Karma, like Abhyanga or the Anuvasana Basti is not required. Even the time restriction is not there. So the basti called Yapana Basti, Yuktarata Basti, Siddha Basti has been explained in our classics. So with the help of those things, so I have said you IVDP in that condition. So even the Vaitarana Basti, that is Tikshna Vaitarana Basti, can be used to treat the acute condition. So even we have experienced this in our PG time, and even the same thing I am practicing in my clinic. So based on different condition, not only I have given just two examples, so certain things, even you might be knowing, so that Snigdhagni Karma, so that can be used to maintain the acute condition of particular diseases like acute pain and all. Then, so how we should approach to acute disease, and can we give symptomatic treatment? If yes, please explain. Yeah. So of course, so when it is an emergency case, of course we should go with the symptomatic treatment. So, but that symptomatic treatment should be also Ashuddha Chikitsa. For example, when there will be Atisara, so by considering that as an acute case, we directly should not go to the Stambhana Chikitsa. So we should convince the patient, because what the patients do usually, so they will take the medicine, but they will not follow the other things that we say in form of Patya or Nidana Parivarjana. If they are following that Nidana Parivarjana and Patya, of course, our simple treatment or the exact treatment that has been mentioned in classics works as the emergency treatment. A simple Dadimatvak Swarasa, so or the Dadima Phalatvak Swarasa or the Kashaya works beautifully in Atisara. So that if we give, so that is the best Deepana Pachana and Grahi. So directly if you go with Kutajaganamati all the time, so it may, if not today, after 1 or 2 weeks, of course, the system will be corrupted. Once again, it comes in form of different symptoms. So in that condition, even in the Jwara, sometimes if it is Pittaja Jwara, a simple Godanti Basma should be mixed with Kshira and it can be given sublingual. So within 10 or 15 minutes, you can see the changes in the temperature. So all the time, the symptomatic management so cannot be used, but in emergency condition, of course, you can use, and followed by the systematic treatment should be continued. Yeah. So till what extent we can treat emergency cases? So I have already given you the example of hypertension and diabetes. So we should be knowing whether the condition is emergency or not. If the condition is already chronic and still, so you need to go with the opinion of other system. If the patient has not undergone with any investigation, of course you need to go with the or rule out the condition, then only you should take the treatment. So by considering that is emergency condition, you should not intervene with any other treatment, because sometimes so the placebo effect, maybe not because of our medicine, maybe because of the actual condition, so it may bounce back towards you. So in that condition, you should be very careful whether it is emergency or not, that is secondary, but you should consider or you should go with the all the diagnostic aids, and you should diagnose the disease and you should understand the condition, then only you should start the treatment. So all the questions are related with the emergency medicine only. So I have given you all the example, I think. So I hope you have understood about the emergency management. So if you go with the or ask the particular disease, so that we can answer better.
Yes, sir. We understood. Thank you so much for clearing the doubts. Your session has been truly overwhelming for us. The way you have on clinical case examples into each point has kept us engaging and alert, sir. We particularly appreciate the novel approach of counseling in Nidhana Parivarjana, and the introduction to Mantra Chikitsa was a revelation. Your unique teaching style has made the session an unforgettable experience. The insights shared were impressive, empowering, motivative, inspiring us thinking in a new direction. On behalf of Team Ayurana, I extend heartfelt gratitude to our esteemed speaker. Thank you so much, sir. A huge thanks and gratitude to the entire Ayuryana team for organizing this incredible webinar. Your collective efforts have made a significant impact. A special thanks to Dr. Chaya for hosting today's session. Thank you. Dhanyavada to each and every one of you. Thank you.